For our first lesson, I will be going over ABGs. ABGs are also known as arterial blood gases. Arterial blood gases is a lab draw that is usually taken by respiratory to help the physician visualize what is going on with the patient. So we will get a lab value which illustrates a patient's pH, their CO2, their bicarb, and their O2. These samples all come from the artery, so it's the most accurate depiction of how the patient is actually doing, besides looking at their pulse oximetry reading. First off, I want to go over the process of getting an ABG, and then I want to go over normal values, and then I want to go over the systems in the body that run these values, that maintain the CO2 and that maintain the bicarb, and how we can manipulate those if a patient is on a ventilator. So, first off, we obtain the ABG, like I said before, from respiratory. It's taken from an artery. Usually it's taken from the radial artery with a pretty large needle. The needle that they use and the syringe is heparinized. The heparin is aspirated, and then about an ml or 2 of blood is taken, which is sent into the processing unit, and the ABG's results are populated, which include the pH, the CO2, the bicarb, and the O2. So, first off, the normal pH is 7.35 to 7.45. The way I remember the normal CO2 is by remembering the pH. So same as the pH was, 35 to 45. The normal bicarb is 22 to 26. And the normal O2 levels are anywhere from 70 to 100. Sometimes in the hospital setting, you'll see the physicians say that normals are anywhere over 60, but in a utopian world, the normal O2 values would be 70 to 100. And this is obviously in the blood because the normal pulse ox value is, as we know, 92 to 100, but the blood components are a little bit different. So, to further explain the regulation of the pH in the blood related to CO2 and bicarb, I have to explain the importance of the lungs and the importance of the kidneys in this regulation. So, let's say if someone is hyperventilating. If they're hyperventilating, do you think they would have more CO2 or less CO2 in their body? You're correct if you said less. Because they're hyperventilating, they're blowing off a lot of CO2. That means the CO2 in the blood could probably be around about 20. So I'll just say 20s for the CO2. CO2, hyperventilating. Say the patient is in respiratory arrest and they are not breathing well at all, or say they have some sort of lung abnormality which is preventing them from breathing adequately. They have sclerotic lungs, something just prevents them from having a good inspiration and expiration. So, their CO2 will be higher because they are hypoventilating, breathing less than normal. Like we know, the normal respiration rate is 12 to 20. So anything below 12 would be hypo, and anything above 20 is hyperventilating. In relation to the CO2, high CO2 is hypoventilating, and then vice versa, low CO2 is hypoventilating. To further clarify, CO2 is an acid. So if someone is breathing too much and hypoventilating, they will have low CO2, which means that their pH, if they have low CO2, the pH will be higher. Inversely, say the patient has COPD. They have a high CO2 because they're not breathing adequately. Because CO2 is an acid, like previously stated, the pH will be lower. So, related to this, you can see how someone's breathing pattern, their respiration rate, can affect their pH. Like I was saying before, if someone's on a ventilator, we can maneuver what's called the respiration rate on the machine to either help the patient blow off more CO2 or try and retain more CO2. What can also help with someone who is hyperventilating is an increase in sedation. Sometimes due to pain or agitation or asynchrony with the vent, patients can have low CO2, which can affect the pH, which can be a big problem. So, to look at bicarb, bicarb is actually a product of the kidneys. Just to further clarify as well, CO2 in a vented patient is something that can be easily changed or maneuvered with the respiration rate on the machine, and it has a quicker turnover rate. So, using the lungs to regulate, the regulation with the lungs can take 30 minutes to an hour. With the kidneys, it can take upwards of a day, 12 to 24 hours to see a change. The kidneys are a lot slower. So if we're expecting the kidneys to regulate the body system, we're going to have to wait a little bit longer time than compare with the lungs. So, like I said before, the kidneys produce bicarb. Let's say someone has AKI, also known as acute kidney injury. If the kidneys are expected to produce bicarb and someone has kidney injury, we could expect the production to be less, which would cause the bicarb levels to go down. I'm hoping this all makes sense so far. Because the bicarb levels go down, the pH will also go down. Okay? One of the things that we can give to help the management of the kidneys, if the bicarb level is low enough, the marker that I've seen and that Up to Date has stated is that if the bicarb is under 13, that is when it's time to start a bicarb drip. So a bicarb drip is, well, it can be kidney protective, but it's also kidney supportive to assist with the production of bicarb. And if a patient has no production or minimal, the supplemental drip will help to normalize the pH when necessary. Helps to normalize pH. pH. I hope that's made sense so far. So to go over, the kidneys and the lungs are both regulatory mechanisms to control blood pH. When blood pH is out of whack, the patient can die. So death can happen with a pH of 6.9 or less and a pH of 7.8 or higher. So as you know, a person, a healthy person, we want to be right in the middle. With the kidneys and the lungs regulating the pH, we can see with the values that are given if the kidneys and the lungs are fully or partially compensating. For example, just try and keep these normal values in your head or write them on a sheet of paper. So I'm going to go through a scenario. I'm going to go through a fully compensated, and then a partially compensated. So for a fully compensated, the pH has to be normal. So it has to be between that 35 to 45 range. So right in the middle, 7.4 is a perfect pH. Let's say the CO2 of, we'll call him Mr. Smith. The CO2 of Mr. Smith is 60. He has COPD, so he's retaining. COPD. The bicarb of Mr. Smith is 35, so it's definitely increased. Ooh. And O2 is 70, so he's not hypoxic, he's within normal. We call this ABG fully compensated because the main factor is the pH is normal. The underlying issue is usually where the pH is teetering towards. So because 7.4 is right in the middle, this one can be a little bit difficult, but if the pH is exactly in the middle, I would then look at the abnormalities. You want to look at both the CO2 and the bicarb and see which one is the most abnormal. So looking at these values, it can be seen that the CO2 is the most abnormal. So for this ABG, the resulting insult is respiratory acidosis because the CO2 is high. That's fully compensated. Hopefully that makes sense. For a partially compensated ABG, let's say Mr. Smith is in acute on chronic COPD exacerbation, but his body's getting tired and his pH is abnormal because his kidneys are not compensating as well. So the pH will be abnormal. So it'll be low. So I'll say 7.3. The CO2 will be high still at 60. And the bicarb will be high as well, with the normal O2 because he's not hypoxic. So the main difference here is that the pH is abnormal in a partially compensated ABG. The regulating mechanism, so the kidneys are still out of range along with the CO2, but the kidneys are not compensating enough to maintain a normal pH. So that is the issue right here. Okay. So we would still call this respiratory acidosis, but partially compensated. Okay. And the last thing I'm going to go over in this video is how to look at ABGs, arterial blood gases, and name them. So like we said before, if the CO2 is high and the pH is low, we consider that respiratory acidosis. However, if the pH is low, let's say 7.2, the CO2 is normal at 35, but the bicarb is 18, which is below normal, we're going to say that this is actually metabolic acidosis. So because bicarb is a base, when there is low bicarb, the pH will also be low, because if there's low base, it'll make the pH more acidic. Okay, metabolic acidosis can be due from things such as vomiting, diarrhea, actually, for this instance, let's just say diarrhea. Okay, and then now for high pH, let's say the CO2 is low. So CO2 is 20, pH is 7.5. One of the reasons that this could happen is from hyperventilating. Someone's having an anxiety attack. We could also say they're under sedated. If they're vented, their respiration rate is too high in the vents. This can be due to a multitude of things. Another reason why the pH can be high, let's say 7.55. If the CO2 is normal, we'll say the CO2 is 40, but the bicarb is high. We'll say the bicarb's 35. So this can be due to medications. A bicarb drip, it can be due to overuse of antacids, which is one we commonly see in the hospital setting. This is an important one to look out for. And just like a low pH is dangerous, a high pH is also dangerous and should be figured out. Okay. If there are any questions about what I just did, please feel free to leave a comment. If you appreciated this post and it helped you understand ABGs a little bit more, that is what I'm here for. And I hope that it assisted you in this information.